Welcome, ladies and gentlemen, to my cardiology lectures. Today's topic is hypertrophic cardiomyopathy. Before I begin, I would like to define the word cardiomyopathy for those of you who don't know what it means. Cardiomyopathy is the disease process of the heart muscle. Hypertrophic cardiomyopathy is a disorder that is caused by a mutation in the cardiac sarcomere protein gene. Hypertrophy is characterized by the increase in the size of the cell and the amount of viable tissue mass. This occurs when significant burden is introduced into an organ such as the heart or skeletal muscle tissue. Let's take the heart for example. The heart is a muscle. It is divided into four chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. There are two major veins that return deoxygenated blood back to the heart. These veins are the superior vena cava and the inferior vena cava. The heart takes this blood and it gives it to the lungs. The lungs then communicate with the body and they say, hey, we got some visitors here. They're red blood cells. They're proposing a trade. They want oxygen for their carbon dioxide. So what I need you to do is breathe in some oxygen because I know there's plenty out there and I'll make this trade. In exchange, I'll have some carbon dioxide for you to blow off. The lungs make the trade and return the blood back to the heart. The heart takes this oxygenated blood and pumps it out to the rest of the body. For most people, this is a normal process. Keep in mind that there's already some degree of resistance that exists within the heart. The atria do not need to deal with as much resistance like the ventricles do because of gravity. The right ventricle needs to pump deoxygenated blood to the lungs. On the other hand, the left ventricle needs to pump oxygenated blood to the rest of the body. What does this mean? This means that naturally the chamber of the left ventricle will be thick. That is, thicker than the other chambers. Let's throw something else into the picture. Let's throw valvular stenosis. The heart muscle now needs to deal with a lot more resistance than it normally does. What does the heart muscle do to adapt to a change such as valvular stenosis? The heart muscle will go through mitosis. If balance cannot be achieved through mitosis, hypertrophy ensues. What happens when muscle cells hypertrophy? They're calling in backup. They're saying we need more actin, we need more myosin, we need more ATP. We don't have enough, we need more. What are some causes of hypertrophic cardiomyopathy? Most causes are genetic. However, things like hypertension, and aortic stenosis can lead to the development of hook'em if these are left untreated. Signs and symptoms of hypertrophic cardiomyopathy. These include dyspnea on exertion, syncope, palpitations, orthopnea, and paroxysmal nocturnal dyspnea, exertional chest pain, and sudden cardiac death. Most cases are asymptomatic, but if a patient exhibits signs and symptoms, they will have these shown here. Unfortunately, the most common signs and symptoms seen in this disorder are syncope and sudden cardiac death. A lot of these cases are seen within the young athletic population. A young kid goes to a game, he collapses out of nowhere. This is in your differential diagnosis. Physical exam findings. These include double apical impulse, normal S1 and S2, S4, double carotid pulse, systolic ejection, crescendo, decrescendo murmur, holosystolic murmur of mitral regurgitation in the apex and axilla, and an apical precordial impulse that is displaced laterally and is usually abnormally forceful and enlarged, reflecting the hypertrophy.